The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos.
I can see why Brad asked me not to sit at the table. I'm going to be talking today about a topic that Linda assigned to me, and it's something that we could spend 15 days talking about, so I'm not going to even scratch the surface. But I hope to give just a little bit of detail on where we might be with the science today. I'm going to talk about the dimensions of asbestos. I'm going to ask the question, 3 questions. So keep in mind that as a professor, there will be a test. 3 questions. First question, are thin fibers hazardous?
Yes.
Number 2, are short fibers hazardous?
Yes.
Is chrysotile hazardous?
Yes.
All right, any questions? All right, size matters. 1 inch is equal to 25,000 micrometers or microns. So a micrometer is extremely tiny. A human hair is 100 micrometers wide. Gives you an idea that you can barely see a human hair. Chrysotile fibril, on the other hand, is 0.02 micrometers wide, which means if you do the calculations quickly, you can fit 5,000 fibrils across a human hair. That gives you an idea of how thin these fibers are. We know that fibers with a diameter of less than a half a micrometer can penetrate to the alveoli. We know that asbestos fibers are rocks, and therefore they're very durable. They're going to last in your lungs for the rest of your life. And asbestos has many modes of action. It's not just a simple way that they work, but they have many different ways of interacting with the body to cause asbestos disease. And something that I thought about recently is that asbestos is terminally patient. It sits there for decades and decades and decades, and at some point it might get lucky and you might get unlucky. Are thin fibers hazardous? There was a landmark study back in 1981 by Stanton who looked at all the animal studies that have been done with fibers of measured sizes, and part of his hypothesis was that the most pathogenetically active fibers are thinner than 0.25 micrometers. And then more recently, Leslie Stainer looked at populations from a factory where workers have been working with chrysotile asbestos in the middle of the century. They found some filters from the 1960s and 70s, and that filled a huge gap because I can talk about this later over dinner, but we didn't really know what the asbestos concentrations were because PCM is just not good at identifying and measuring all asbestos fibers. So they were able to analyze some filters by electron microscopy and compare them to the outcomes, that is, factory workers. 3,000 factory workers, and their conclusion was that the thinnest fibers were the strongest predictor of lung cancer or asbestosis mortality. So thin fibers were confirmed with this study by TEM. Then Loomis, in a similar study, got hold of some of those filters. There are several hundred filters they found. Somehow they found them, and they've been analyzed in the last half dozen years. So now we finally got some fiber measurements to correlate with the outcomes. And they found a negative correlation of fiber diameter versus both lung cancer and asbestosis. What we just found out with Stainer's study, that is, the thinner the fiber, the more likely it is to produce asbestos disease. Are short fibers hazardous? Let's go back to Stanton in his 1981 landmark study, and there's 2 parts to his hypothesis. The most pathogenetically active fibers are thinner than 0.25 micrometers and longer than 8 micrometers. This is based on animal studies again. But 10 years later, Agnes Kane took a look at all of the studies that have been done on measured fiber populations and animal studies. And her conclusion was both long and short chrysotile fibers are toxic. Going back to Loomis, remember he did those studies on the Carolina factory workers with reanalyzed filters by TEM? And he reported that long fibers are indeed good predictors for lung cancer, but not for asbestosis. And there's another but in this paper, and that is that he found that there were certain short fibers, there was a short fiber population that also had a correlation with the asbestos diseases. So it wasn't just the long ones, but there was also this cohort of short fibers, which raised some questions about the Stanton hypothesis. Suzuki took a look at thousands of fibers in tissues of patients who had asbestos disease, and he found that 90% of those fibers were shorter than 5 micrometers, excuse me. His conclusion was, it is not prudent to take the position that short asbestos fibers convey little risk of disease. Many of you know Ron Dodson. Ron Dodson looked at the available studies on both animals and humans in 2003, and he and his colleagues concluded that asbestos fibers of all lengths induce pathological responses. Let's go back to the Stanton hypothesis. Remember, less than 0.2 micrometers wide and longer than 8 micrometers wide. It's quoted by all of the people who are disciples of the long fiber is hazardous theory. But what you never hear them quoting, and this is from Stanton's abstract, he said, but relatively high correlations were also noted with fibers in other size categories having diameters up to 1.5 micrometers and lengths greater than 4 micrometers. In other words, they're all hazardous. So let's think about exposures. Okay, the long ones may be a little bit more toxic in some situations, but Loomis found out that exposures were highest for the smallest fibers. So in a fiber population that you're inhaling, there ain't that many long ones. I had a chance to review the data from the Superfund site in Ambler, Pennsylvania, looked at the concentrations, and these were mostly ambient concentrations, but there were also some that were associated with ABS. And fibers longer than 5 micrometers constitute less than 10% of the total asbestos fibers. So again, they're only a very small part of the population that's going to be inhaled. So if long fibers constitute less than 10% of what you're breathing in, they'd have to be at least 10 times more hazardous to cause the same hazard as the population of short fibers that you're breathing. And I think this is something that a lot of the people who are involved in risk don't really fold into their evaluations. But I'm hoping that with the recent reanalysis of filters from the old work conditions, that now we'll have some real fiber dimensions to work with, and they can start working with TEM fibers and use that in determining risk. Is chrysotile hazardous? Here's a quote. Mesotheliomas linked to exposure to asbestos are associated with amphibole fibers. You've probably heard that before. It's the amphibole hypothesis, and it comes from a reputable source, the Chrysotile Institute, formerly called what? The Asbestos Institute. Let's go back to Stanton. Even before he did his landmark publication in 1981, he was working with asbestos and fibrous glass, and he observed a high incidence of mesothelioma in rats exposed to chrysotile. That was 40 years ago. Going back to Loomis, another one of his studies where they looked at the asbestos concentrations in 4 chrysotile plants. It was only chrysotile in these plants. He found that chrysotile was associated with increased risk of lung cancer, asbestosis, cancer of the pleura, and mesothelioma. This is a very recent paper. And then Dr. Lemon, in the NIOSH roadmap for asbestos, 4 years ago, talked about mesothelioma and chrysotile. He said that unlike amphibole asbestos, chrysotile fibers break apart in the lung and hence are multiplied. And this is critical because right now the paradigm is that surface area of asbestos is what is the biggest interaction or biggest parameter in determining risk. So if the fibers are breaking up, you've got larger surface area for interaction with the body. And he said this causes higher translation of chrysotile from the lungs to the pleural space. In other words, they go out of the alveoli into the space between the lungs and the pleura. And there he says it's biologically plausible that it causes or contributes to cause mesothelioma. So this is consistent with what Dodson has been saying for a while about chrysotile and the short fibers that are inhaled. So let me come up to the conclusion and if you pass the test, we can put on the 3D glasses and look at some eye candy. All right, question number 1. Are thin fibers hazardous? Good. Are short fibers hazardous?
Yes.
Correct again. And 67% is not going to pass you. Is chrysotile hazardous?
Yes.
All right, let's go on with the 3D glasses. So hold the glass to the left eye is looking through the blue lens. Can we get lights turned down a little bit? Yeah, maybe not. Well, so you should be seeing an SUV poking out from some tree stumps. Now here's some fibrous talc from upstate New York. And that particular bundle is about 2 millimeters across. But you can see there are a lot of small fibers dangling off of it. If we go up in magnification, we can see the thin fibers that really are of concern. As we go up in even higher magnification, you can see again that there are even thinner fibers, and it's these very thin fibers that are going to be most hazardous. Let's take a look at a bundle from Libby Vermiculite. And this bundle is like a grain of rice, and I've scratched it with a needle. And you can see the furrow going down through between the 500 and the micrometer sign. And you see coming off the sides of the furrow a bunch of fibers. In a higher magnification, that's what that grain of rice is. It's just composed of millions and millions of these very small fibers. Finally, let's take a look at tree bark near Libby, Montana. And this is dust that's on tree bark. And if you look at the very middle, you can see that little bean-shaped particle. And if you're close enough, you might see a fiber coming out of that. But as we go up in magnification using electron microscope, you can see that there are more thinner fibers. Going up even higher magnification, you can see that there are even more thin fibers. So these are the kind of fibers that we are most concerned about, are the very thin ones. And then finally, just a quick word, Johnson Conference in 3 months, University of Vermont, 3rd week of July. If you want to get really granular in your understanding of the science of analysis, monitoring, and health aspects of asbestos, that's where it is. I'll be glad to talk to you about any of that. You didn't even have to put up your sign, did you? All right, we're putting you back on schedule. Thanks a lot.
Thank you, Jim.